So if somebody with Parkinson's gets COVID-19, I think it's important to first recognize what level or stage of the condition they're at. I think we need to all recognize that there might be pre-existing respiratory problems in people with Parkinson's. The respiratory muscles might be rigid, and also there might be potentially a theoretical risk of impairment of the brainstem mediated cough reflex. If this is so, particular attention might be given to breathing, chest exercises, chest physiotherapy, and fighting the potential of an aspiration pneumonia with relevant antibiotics or other therapies. In addition, some of these patients might have worsening of their hypokinesia or akinesia, so the levodopa requirement might go up, and as such, you might need to monitor your dosing. The rest of the management will really fall in line with the management of COVID-19, what stage one is, if they need additional respiratory support, if they need CPAP or ventilation, keeping in mind that the respiratory problems might be exacerbated in Parkinson's because of pre-existing problems of dyspnea or respiratory difficulties. In addition, there is some theoretical considerations to be had. As we've said, exercise, if this can be implemented, is very good. Chest physiotherapy should be very good. And some people would argue that the use of an antiviral drug, such as amantadine, might be beneficial, although I have to state that at this moment in time, there is no clear evidence base to suggest that amantadine is useful for managing COVID-19 in Parkinson's, but theoretically, at least, to some extent, it makes sense. It is important to note that cough is an important symptom of COVID-19, particularly dry cough. It is therefore possible that many people with Parkinson's might seek over-the-counter cough remedies. And many of these remedies might actually interact with the monoamine oxidase inhibitors, such as rasagiline, such as selagiline, or even possibly sulfonamide, if the person is on it. So it's worth remembering this potential interaction between these two. Apart from this, I do not think there is any other major interactions to worry about. Anxiety is a particular problem in Parkinson's. Many people with Parkinson's have a generalized anxiety state. Motor fluctuations can aggravate anxiety. And sadly, as yet, we do not have a very good anti-anxiety treatment strategy for Parkinson's, even though we have so much in the form of motor management. As such, anxiety that can be triggered by the lockdown, by the social isolation, are all very relevant, and it is really important to manage this properly. It doesn't necessarily mean that you have to jump into anti-anxiety treatment, but provision for telehealth, provision for remote management, so that the person with Parkinson's and their carers are aware that there is support available when required is really crucially important. And in some situations, you might have to take recourse to anti-anxiety, specific anti-anxiety treatments. In relation to exercise, again, very, very important, both physical and mental exercise, very important to keep the overall health of Parkinson's well. And in this respect, this time, particularly exercise strategies that can be undertaken through apps, through the virtual systems that are available, through the various programs that are available are important. And again, it's important that the clinician and the nurses, nurse specialists, together with the patients and the carers, take a joint decision on personalizing that exercise that is correct and right for that particular person. I think as healthcare professionals, we need to be aware that we should not be spreading a message that needlessly worries our people with Parkinson's and their carers, but at the same time recognize that a certain subsection of people with Parkinson's, particularly those with more advanced disease, those with significant comorbidities such as diabetes, or those who are on advanced therapies, might be particularly vulnerable. And if they do get COVID-19 infection, they will need to have some specific strategies implemented. So for the clinician, for the healthcare professionals, it's important to be aware of the special needs that might arise should such a patient be infected with COVID-19. And so that the team that's managing such people in the front line are made aware that there might be special needs, and this might mean specific anxiety management. Some people get a lot of fatigue, so management of fatigue, um, need for non-oral therapies, need for perhaps increased levodopa requirement, and also the the need for exercise and rehabilitation as soon as the patient is able to do so is very important. Also important to remember that if respiratory system is involved, if there is a pneumonia, then particular attention needs to be paid to the fact that such patients are also perhaps increase susceptible in an increased manner to aspiration. So I think that is important to recognize as well.